Hi everyone, this is Dr. Praveen S. Patil here. Today I am going to talk about the investigation called serum amylase or urine amylase, acetic fluid amylase, or as this one effusion fluid amylase. Amylase is an enzyme which is mainly secreted by the pancreas. Hence, the presence of this amylase or the exceed present or increased in the serum amylase is used to identify the pathologies of pancreas, basically pancreas. Introduction. Serum amylase and lipase are widely used investigations in pancreatic pathologies. Amylase is investigated mainly from serum and as well as from the urine, ascitic fluid, and pleural fluid. Serum amylase is present or get increased in case of pancreatic inflammation is a reliable investigation. It will increase 3 times more than the normal that indicate the pancreatic inflammation. This increase in the serum of course reflect on the urine uh, amylase. So urine amylase will get increased because of increased renal clearance and is infrequently used because it's an indirect method of identifying the increased amylase in the serum. Ascitic fluid amylase will increase in case of disruption of the gland and this of course is a false positive seen in case of the intestinal obstruction and ulcer perforation. Amylase in the pleural fluid indicate a exudative effusion due to the pancreatitis that is commonly seen on the left side. This a false positive occurs in case of lung carcinoma and esophageal perforation because amylases also get secreted by the lung. Hence, in case of lung carcinoma and all, the amylase will get increased. Significance of this investigation. So, value greater than 3 times the upper limit with epigastric pain strongly suggests the pancreatitis. Pancreatitis, in case of pancreatitis, usually elevated, amylase will get elevated within first 24 hours and it will remain in elevated condition for 3 to 7 days and it will come back to normal by after 7 days. Even though there is a pancreatitis, sometimes the serum amylase remains normal. That is delay before the blood sample is obtained. That is two if the blood sample is taken after 2 to 7 days of the onset of the pain. And in case of mild pancreatitis or else in case of chronic pancreatitis, the amylase may remain normal. And if the pancreatitis is due to the hypertriglyceridemia, then also the amylase will remain normal. There are some non-pancreatic conditions in which the serum amylase will increase because it's also found in the salivary gland, it's found in the fallopian tube, it's found in the pregnancy, it's found in the lungs, and thyroid gland and tonsil, and various tumors like breast tumors and all. Hyperamylasemia, that is increased serum amylase, and hyperamylasuria, that is increased amylase in the urine. These are found in the pancreatic conditions like acute pancreatitis, chronic ductal obstruction, pseudocyst, pancreatic necrosis, duct disruption, and as well as in the pancreatic trauma and pancreatic carcinoma. So, increased amylase is seen in the non-pancreatic conditions also like renal insufficiency, salivary lesions like bumps, calculus, maxillofacial surgery, irradiations, adenitis, and burns, diabetic ketoacidosis, pregnancy, and cerebral trauma, and drugs like opiates. So these are the non-pancreatic disorders in which the amylase will increase. Amylase is seen in not only in the pancreatitis, some other abdominal conditions are also like cholecystitis, choledocholithiasis, perforated peptic ulcers, intestinal obstruction, ruptured ectopic pregnancies, peritonitis, aortic aneurysm, and post-abdominal operations. So amylase will increase. Then what is the reliability of this investigation? So always better to go for serum amylase as well as the lipase. So both together we can come in, if the amylase is increased and lipase is decreased, then it may indicate an early stage of the pancreatitis. If both are increased, then it indicate early stage of pancreatitis. If the amylase serum amylase is normal and lipase is increased, then also is indicative of the later stage of pancreatitis. So this is about the amylase. If you like this video, then you can uh, please subscribe to the channel. And if you have any queries, you can put on the description box. Thank you. Thanks for watching my video.